Rabies is an ancient virus that continues to be one of the most feared diseases worldwide. With a mortality rate close to 100% once symptoms appear, understanding the danger rabies presents and our available treatment options is crucial. This highly lethal virus is primarily transmitted through the bite of an infected animal, commonly dogs, but also bats, raccoons, and foxes in certain regions. Let us first delve into the pathology of rabies. Once the rabies virus enters the body, it targets and multiplies within the nervous system. This journey typically begins at the site of entry, often a bite wound, before traveling through peripheral nerves to the spinal cord and brain. This progression takes weeks, sometimes even months, which is why there is often a delay before symptoms manifest. However, once the virus reaches the brain, it causes encephalitis, a swelling of the brain, leading to the onset of symptoms that include fever, anxiety, confusion, and agitation. As the infection worsens, patients may develop classic signs of rabies: fear of water, excess salivation, hallucinations, and ultimately, paralysis. Given these severe manifestations, the key to combating rabies lies in prevention and early intervention. The rabies vaccine is the most effective preventive measure. Administered in a series, post-exposure prophylaxis with this vaccine can prevent the virus from taking hold if given promptly after a potential exposure, ideally within the first 24 hours. However, once the clinical symptoms appear, the disease is nearly always fatal, despite efforts to treat it with supportive care or experimental protocols. Public health initiatives play a pivotal role in rabies control as well. By promoting widespread vaccination of domestic animals and controlling the population of stray animals, instances of transmission can be significantly reduced. In many developing countries, lack of resources and inadequate public awareness hinder these efforts, leading to thousands of human fatalities each year, most of whom are children. While there is still no definitive cure for rabies once symptomatic, advancements in medical research continue to offer hope. The Milwaukee protocol, for example, has seen limited success, with some patients surviving under stringent medical intervention. However, these cases are rare and emphasize the need for early preventive action. In conclusion, rabies remains a formidable disease due to its high fatality rate and the speed at which it progresses once symptoms are present. Prevention through vaccination, both pre- and post-exposure, remains our most reliable line of defense. Continued public education and access to medical resources will be crucial in reducing the global burden of this deadly virus. With vigilance, rabies can be kept at bay until more robust treatments become available.